Hello and welcome to another edition of What's Your Why Wednesday. I'm Andrew Gofrak, our Chief Executive Officer, and I'm thrilled to be joined today by Julie from our laboratory department. Julie, welcome.
Thank you for having me here.
Absolutely.
Hi.
Would you mind telling us a little bit about yourself and how long you've been at Arrowhead?
Yeah, hi, I'm Julie. My journey actually started right here at ARMC. I went to the School of Medical Technology here to study clinical laboratory science and became a scientist. After I finished, I ended up staying because I really like this community. The program really taught me the skills that I need to be a good scientist. And there's something so special about being able to give back to the same hospital that believe in me. I've been here for 3 years now, and what makes this place amazing is my team. Mm-hmm. The lab is just a big family. We are very supportive of one another, and we truly love our job because even though we rarely see patients, the work we do behind the scenes are very important to their care. And since most medical diagnosis comes from the lab, it makes our job very fulfilling.
That's great, and I don't think a lot of people fully appreciate it or know even that we have our own school of laboratory medicine right here at ARMC, and to have you with us today and to see that not only can you get your degree here, but you can continue and stay on at Arrowhead and work with us and really fulfill that mission is just so wonderful. ARMC is very special, right? We are the county-owned hospital. We're a tertiary academic medical center. We serve such a diverse population in the largest county in the United States. How does that notion of the who we take care of, how does that connect with the why you do what you do?
Yeah, this hospital is one of a kind. We serve an underserved community where it's probably going to be the patient's first time or the only time to be seen by a doctor. Mm-hmm. And it's very important for us to give them the accurate and timely diagnosis for their treatments.
I appreciate that, right? It's so critical when our patients come in, whether they're in the trauma center or for even outpatient appointments, to have that timely diagnosis and that timely and accurate information from our lab is just so critical to help our clinical teams make those determinations and either have a course of action for care or to put patients' minds at ease, right?
Yes.
So I really appreciate everything that you do. It's very clear that you bring a lot of passion in what you do, which I think really does help the overall clinical journey. You mentioned that you guys are behind the scenes, but every single role at Arrowhead plays a critical role, right, for our patient care. So whether you're at the bedside or in the laboratory or anywhere else, every role plays a significant part. So Julie, again, I really appreciate you taking the time today and sharing your journey. It's great to see individuals like yourself coming through our programs and then continuing to grow within the hospital. So thank you very much.
Thank you so much. Thank you.
This is another edition of What's Your Why Wednesday. I'm Andrew Gofrak, and stay tuned for next month's edition.